Welcome to our comprehensive guide on managing medically compromised patients in oral surgery. In today's video, we'll break down essential protocols and considerations every dental professional must know to ensure patient safety and successful outcomes. We'll start with the ASA Physical Status Classification, move through stress reduction strategies, and cover specific management for cardiovascular, respiratory, diabetic, hepatic, and renal conditions. Whether you're a student or a practicing clinician, these practical tips will help you navigate complex cases with confidence. Let's begin by understanding how to assess a patient's overall medical risk before surgery. The ASA Physical Status Classification is a foundational tool for evaluating a patient's medical risk prior to oral surgery. ASA refers to a normal, healthy patient with no systemic disease. ASA 2 includes those with mild systemic disease, such as well-controlled hypertension or diabetes. ASA 3 is for patients with severe systemic disease that limits activity but isn't incapacitating. ASA 4 represents those with severe systemic disease that is incapacitating and poses a constant threat to life. ASA 5 is reserved for moribund patients not expected to survive without the operation. Finally, ASAE denotes an emergency procedure. This classification helps tailor surgical planning and risk mitigation. Stress can significantly impact medically compromised patients during oral surgery. To minimize risk, schedule appointments in the morning and keep them short. Communicate clearly with patients about their fears and concerns, which can help reduce anxiety. Preoperative sedation, such as benzodiazepines, may be considered for anxious individuals. Ensure profound local anesthesia, using topical agents before injection to minimize discomfort. Additionally, take steps to avoid postural hypotension and hypoglycemia, especially in patients with cardiovascular or metabolic disorders. These protocols create a safer, more comfortable environment for both patient and provider. Patients with cardiovascular disease require special attention during oral surgery. Certain conditions, such as unstable angina, congestive cardiac failure, valvular septal defects, and recent myocardial infarction, increase surgical risk significantly. For those on anticoagulants, minor procedures can usually proceed if INR or PTR values are within the therapeutic range. If not, intravenous anticoagulants like heparin may be necessary. In the event of angina during a procedure, stop immediately and administer sublingual nitroglycerin. For unstable cases, terminate the appointment. Routine care should be postponed for at least 6 months following a myocardial infarction. Many cardiovascular patients take anticoagulants to prevent clotting. For minor oral surgery, these medications are typically not withdrawn if the patient's INR or PTR is within the therapeutic range. This minimizes the risk of thromboembolic events. However, if these values are outside the safe range, the patient may need to switch to intravenous anticoagulants, such as heparin, under medical supervision. Always coordinate with the patient's physician before making changes to anticoagulation therapy. Proper management ensures both bleeding and clotting risks are minimized during and after the procedure. If a patient with a history of angina experiences chest pain during oral surgery, it's crucial to act quickly. Immediately stop the procedure and administer sublingual nitroglycerin up to 3 tablets within 15 minutes. Monitor the patient's response closely. If the pain persists or the angina is unstable, terminate the appointment and seek medical assistance. These steps are vital to prevent progression to a myocardial infarction and ensure patient safety. Always have emergency medications and protocols in place when treating high-risk cardiac patients. After a patient suffers a myocardial infarction, routine dental care should be postponed for at least 6 months. This waiting period allows the heart to recover and reduces the risk of complications during oral surgery. During this time, only emergency dental procedures should be considered, and always in consultation with the patient's cardiologist. When resuming care, reassess the patient's cardiac status and ensure all medications are optimized. This approach prioritizes patient safety and helps prevent adverse cardiac events in the dental setting. Hypertension, defined as blood pressure above 140/90 mm Hg, is a common finding in dental patients. If a patient's blood pressure is significantly elevated, delay routine dental therapy until it is well controlled. When local anesthesia is required, use formulations with minimal vasopressor content and avoid adrenaline whenever possible to reduce cardiovascular stress. Monitoring blood pressure before and during the procedure is essential. These precautions help prevent hypertensive crises and ensure a safer surgical experience for patients with high blood pressure. Patients with respiratory diseases, such as asthma or chronic obstructive pulmonary disease, require special preparation before oral surgery. Always ensure bronchodilator inhalers are readily available in the operatory. Common triggers for asthmatic attacks include stress, anxiety, and exposure to certain dental materials like methyl methacrylate or tooth enamel dust. Minimize these triggers by maintaining a calm environment and using alternative materials when possible. Prompt recognition and management of respiratory distress are crucial for patient safety during dental procedures. Asthmatic patients may react to various triggers in the dental setting. Stress and anxiety are common culprits, so effective communication and reassurance are key. Dental materials, such as methyl methacrylate and tooth enamel dust, can also provoke attacks. To minimize risk, use alternative materials when possible and employ high-volume suction to reduce airborne particles. Always have emergency protocols and medications on hand. By anticipating and managing these triggers, dental professionals can provide safer care for patients with respiratory conditions. Diabetes mellitus is a metabolic disorder that affects oral surgery management. There are two main types: type 1, which is insulin dependent, and type 2, which is non-insulin dependent. Both types require careful monitoring of blood sugar levels before, during, and after surgery. On the morning of the procedure, check the patient's blood glucose and adjust insulin using a sliding scale if necessary. Maintaining stable sugar levels helps prevent complications such as hypoglycemia or delayed healing. Collaboration with the patient's physician is often beneficial for optimal management. Maintaining blood sugar levels is critical for diabetic patients undergoing oral surgery. Check the patient's blood glucose on the morning of surgery and adjust insulin as needed, often using a sliding scale. Monitor sugar levels intraoperatively and postoperatively to avoid hypoglycemia or hyperglycemia. Provide clear instructions regarding fasting and medication adjustments before the procedure. These steps help ensure a smooth recovery and reduce the risk of complications such as infection or delayed wound healing. The liver plays a vital role in drug metabolism and the synthesis of vitamin K, which is essential for blood clotting. Patients with hepatic disease are at increased risk for coagulopathies and may experience excessive bleeding during oral surgery. Always monitor bleeding time, prothrombin time (PT), and international normalized ratio (INR) before proceeding. Adjust medication dosages as needed and consult with the patient's physician for complex cases. Careful planning and monitoring help minimize surgical risks in patients with liver dysfunction. Renal disease affects fluid and electrolyte balance, which can complicate oral surgery. Monitor the patient's fluid status and electrolyte levels closely before and after the procedure. Antibiotic dosages often need adjustment based on the patient's creatinine clearance to avoid toxicity. Collaborate with the patient's nephrologist for guidance on medication management and perioperative care. These precautions help prevent complications and ensure safe surgical outcomes for patients with kidney dysfunction. In summary, managing medically compromised patients in oral surgery requires a thorough understanding of their underlying conditions and careful planning. Use the ASA classification to assess risk, implement stress reduction protocols, and tailor management strategies for cardiovascular, respiratory, diabetic, hepatic, and renal diseases. Always communicate with the patient's medical team and monitor vital parameters closely. By following these best practices, dental professionals can provide safe, effective care and improve outcomes for patients with complex medical histories.